Hi guys, my name is Sanjay Gupta. I am a cardiologist in New York, and today I thought I'd do a little video on um, the subject of a patient of mine that I came across a few months ago. This video is titled "The Man with 20,000 PVCs." Okay, so I hope through this video you will learn a few things about how the mind of a doctor works when you're faced with a patient like this. Okay, so this guy was referred to me by his GP, I think it was about 3 weeks ago. And the reason he was sent to me was because he went for a well-man check, which is where they check your blood pressure, they check your heart rate, etc. And the nurse picked up the fact that he had an irregular heartbeat. And he was therefore referred to me because of this irregular heartbeat. Now, what I tend to do is most of the times I will organize for patients to have an echocardiogram and a holter monitor before they come and see me so that I can see them with the results. That means that they already have the results when they first see, I already have the results when they first come to see me. So it means that I can tell them everything at the first consultation. So this guy then turns up. He's a farmer. He works very hard, and he said, "Well, this is why I've been referred." And I said to him, "Do you have any symptoms? Do you feel anything?" And he said, "No, I feel completely well. I do everything that I want to." And I lead to all intents and purposes a normal life, and I don't know what the fuss is about. I then looked at his ECG and I saw that he had a few multifocal ventricular ectopics, so that means that they were ectopics which were coming from the ventricle because they were wide complex and they were in different shapes. I then looked at his holter, and interestingly, he had about 20,000 PVCs. And amazingly, during the holter, he hadn't put anything down in the diary. And I asked him, "Did you get any symptoms at all?" And he said, "No, not at all." The next step was to look at his echocardiogram, and this showed that his heart was essentially normal, apart from the fact that it looked a little bit more muscular. And when you see a muscular heart, you always think about high blood pressure. And I said to him, "Do you have high blood pressure?" And he said, "No." But he did look overweight. He was quite overweight. And then I said to him, "Well, okay." So he said, "What's the deal?" And I said, "Well, your echo shows that you have a structurally normal heart, and your holter shows that you get a few extra beats." And I used the word few because I didn't want to tell him that he was getting 20,000 extra beats. And he said, "Well, that's good, isn't it?" And I said, "Yeah, sure. I mean, if you have a structurally normal heart, then I'm not too worried." But at the same time, in my own mind, I was worried. I was a little bit worried because I thought, why is this? Why is this man's heart so irritable? And because he was overweight, I did his blood pressure, and it was a little bit on the high side at 160 over 90. And I asked him, "Do you sleep well?" And he said, "Yes, I sleep fine." And then I asked him, "Does your wife ever complain about you snoring?" And he said that yes, she does. So I said, "Okay, well, that's great. You know, we'll just organize some blood tests, and I'll probably just send you for some sleep studies." Sorry. We'll send you for some sleep studies, and that was it. And I discharged him because I couldn't see any point in trying to worry him about his ectopics when he has no symptoms whatsoever. So consequently, after that, he came back after a few weeks, having had his sleep studies, and that showed that he had severe sleep apnea. And I checked his bloods, and his bloods were fine. So he had normal bloods, and I sent him for CPAP therapy, which is where you put in a machine, and the machine um, uh, breathes for you when you stop breathing at night. And I brought him back, and I got his results yesterday with a repeat holter just after CPAP, and his ectopics had gone down to 8,000 ectopics from 20,000 ectopics just with PVC, just with the CPAP, and there were no changes. And to my mind, nothing else needs to be done. The patient doesn't have any symptoms. He has a structurally normal heart, and therefore I know that there is nothing to be too worried about. And we found something that could potentially be causing the heart to be a bit more irritable. And I've discharged him, and he's fine. So what I'm trying to point out here is that the first thing is it's not uncommon to have an irritable heart. You know, if I did a holter on 100 people, I would find some PVCs. So that's not a huge thing to worry about. The second thing to say is that not all PVCs are felt, and you can have tons of PVCs and not feel them at all. And if you don't feel them, it doesn't really matter. You don't need to worry about them, apart from knowing whether you have a structurally normal heart. If you have a structurally normal heart, then you don't need to worry about them. Sure, it is good to try and find out why they're happening, and if they are happening, it's important to try and act on those things, because usually it indicates that there's something going on which you could improve on. But other than that, you don't need to be too worried about it. The most important thing is not to freak out about the fact that you've got so many, because the number really doesn't matter too much in the presence of a structurally normal heart. This guy had bigeminy, he had trigeminy, he had runs of non-sustained VT, but I felt comfortable because I knew his heart was coping. He had a strong, structurally strong heart. Also, I found out that he had simple things that I could improve on, like his blood pressure, like sleep apnea, like his weight, and just simple measures resulted in his ectopics coming down. The only reason to try and act on ectopics in the presence of a structurally normal heart is because they are causing terrible disabling symptoms, or because there are so many, more than 25% of all heartbeats are extra beats, in which case there is a chance that if you leave them unchecked over a number of years, they could cause the heart to weaken. And so, but in this guy, just lifestyle measures resulted in his ectopics getting lower. He's promised me he's going to go and lose some weight. I'm sure his blood pressure is going to be better controlled as he loses weight, and we treat his CPAP. And really nothing else needs to be done. The worst thing you can do is worry about it. If the more you get anxious about these things and the numbers, and whether you're getting multifocal ones or whether you're getting bigeminy, if they're not bothering you, don't worry about them. All right? If they're not bothering you, please don't worry about them, because the more you worry about them, the more you'll notice them. The more you notice them, the more frequent they'll get. Because anxiety, stress cause release of adrenaline, cause release of cortisol, and cause release of noradrenaline. Now the problem is with adrenaline is it's a stimulant. With cortisol, it's an inflammatory inflammation mediating agent, and they will both irritate the heart. Adrenaline will directly speed up the heart. The cortisol will cause a relative magnesium deficiency, and consequently, the anxiety will make your ectopics worse. So the point I'm trying to make is that in a guy who didn't know about this, the last thing I wanted to do is tell him about this, because I knew in my mind that he was not at a huge risk because he had a strong heart, and therefore we were able to just get rid of the ectopics to a large extent, and the patient, remains asymptomatic. So I hope this was helpful. Please, the learning points in this is that you can have lots of ectopics without symptoms. You can have symptoms and not have many ectopics. Sometimes you can have symptoms which are not related to ectopics and can just be due to a normal heartbeat. if you have a structurally normal heart, if you don't have a huge number, over 20,000, if you don't have a huge number of ectopics, don't worry about them. Work on your lifestyle. They will get better. All right. I hope this helps. All the best. You can get in touch with me on this website and on my Twitter and my Facebook. Great. Take care. Bye.